So Eddie, what brings you into your psychology appointment today?
Well, I've got some difficult situations at work right now, and I'm just really having a lot of difficulty making the right decision.
I'm sorry to hear that. Why don't you tell me a little bit more about it?
Well,
So Stan, what brings you in today?
Well, I had this real uncomfortable situation at work, and I just don't know what to do about it.
You want to dig a little deeper?
Yeah. That's a tough one.
So Chris, tell me what brings you into your psychology appointment today.
Well, I'm having a lot of issues with my boss, and there's some things at work that I feel very uncomfortable doing.
Why don't you tell me a little bit more about that?
Well,
Meet Eddie, 23 years old, fed up with Washington State Legislature and the way things are going. He decides to perform a grade 5 manipulation, but on his setup, he has a sudden change of heart, and suddenly, his conscience comes into play.
Alright, stop. Now before you crack that spine to the patient in supine and start to cross that line, you better think of the consequence.
But who are you?
I'm your ethical conscience.
That's nonsense. Go to the library, read from Cochrane. Try to tell me that treatment isn't a good plan. Tell him you'll just feel a nudge. You'll be safe for days. No one knows what a grade 5 is anyways.
Yeah, but if it all goes through like it's supposed to, the whole back pain population knows you and they'll expose you. Think about it before you go through the thrust. Grade 4 moves work great, you just gotta trust.
Forget that. Move that spine. Thrust takes less time. Can you afford to treat one guy all day? Are you that rich? Can you really mob all day? Are your hands that ripped? Do you really think he's not gonna tolerate it anyway?
Man, go on and do it. Go ahead, be cool. Get caught, lose your license, and see who's a fool. Don't even listen to Brent, yo. He's bad for you.
You know what, Chris? I don't like your attitude.
Meet Stan. He's starting his first job after PT school and suddenly finds himself in an uncomfortable situation. His 48-year-old boss makes unnecessary sexual advances towards him when nobody is looking. Once again, his conscience comes into play.
Now listen to me. Watch us grabbing your cheek. Been whispering comments in your ear all week. Now all you gotta do is keep quiet, collect paychecks.
No way, this lady's in charge. You can't tolerate comments like that. It's not right.
Yo, she's the boss. You want that fight? It's a job you worked for years. Just keep quiet. It'll advance your career.
Man, don't you have any respect for yourself?
Yeah, but how else can I build wealth?
Man, there's no way this can go on.
You're probably right. I'm out. I'm done.
Meet Chris, a 26-year-old new grad. The owner of his small clinic is pressing him to keep his patients on his schedule long after they are appropriate for discharge. When questioned, the boss says his third-party payer has more reimbursements. At this point, Chris's conscience comes into play.
Alright, calm down. Relax, start thinking.
Forget that. You just caught your boss cheating. Your name's on the chart. His is off it. You're the one at risk while he stands to profit.
Now wait, what if there's an explanation for this payment?
What? Ultrasound for 2 more weeks is needed treatment?
Alright, Brent, maybe he's right, Chris, but think about your future before you start this.
Alright, thought about it. Still want to report him? Protect my patient, my name, and future practice? That's what I did. Be smart. Don't betray your ethics. You gonna take advice from someone who started in chiropractics?
What you say?
What's wrong? Didn't think I remember?
Hey, patients like the never-ending adjustments.
No, patients like PTs actually fix them. Trust in it. How you gonna tell this man to charge for this treatment?
I guess he doesn't need to go the route I went. What am I saying? Discharge your patient, Chris. You can't keep cheating the system like this.
According to the APTA RIPS model for ethical decision-making, this situation falls within the individual realm between patient and PT. The PT must make a moral judgment between right and wrong. This situation is specifically a dilemma because the therapist must choose between 2 right decisions, whether to use evidence-based practice or follow the law. Although the manipulation has been shown to be an effective treatment for Eddie's current situation, ultimately it is against the law in the state of Washington. Eddie decided not to manipulate. This situation falls within the individual realm between 2 PTs. The therapist is dealing with a situation of silence as he knows his ethical values are being challenged, but feels unable to speak up. This decision requires moral courage from the therapist to stand up for his ethics. Stan has been put into an unfortunate situation where his boss is making sexual advances towards him. This is a difficult situation because this is Stan's dream job and he doesn't want to lose it. or create an even more awkward working environment. Stan ultimately made the correct decision by confronting his boss. This challenge falls within the institutional realm. The therapist must utilize the individual process of moral courage to expose the unethical billing going on. This is a distress situation where you know the right course of action but are not authorized or empowered to perform it because your boss ultimately has the authority. Chris is being asked to bill for services which he knows are unnecessary. He must choose between staying silent at the risk of his professional reputation or confronting his boss and possibly losing his job. In the end, Chris ultimately decided to confront his boss.
Now, go ahead.
Meet Stan. He started his first job after PT school and suddenly finds himself in an uncomfortable situation. His 48-year-old boss makes unnecessary sexual advances towards him with no